for our monthly Strengthening Families Networking webinar. Today we're focusing on the implications of the Child Care Development Fund or Child Care Development Block Grant for state efforts to improve child care quality. I'm going to start with some general overview. I'll give some updates from the Center for the Study of Social Policy. I'm Kaylin O'Connor. We'll have updates from the National Alliance of Children's Trust and Prevention Funds from Meryl Levine today. And then we'll get into our main topic, which is implications of CCDF for state efforts to improve child care quality. My colleague Rhiannon Reeves was planning to present and prepared to present today and was actually called away because her daughter is ill and the only doctor's appointment she could get is right now. So we all know that happens sometimes when you're parenting a young child, and we are filling in for her. So I'll be using the slides that she had prepared, and Anna Lovejoy is also with me from CSSP to jump in and help fill out some of the content. So we'll be covering for Rhiannon, and then we're going to hear from two states with who are at different points in their child care quality improvement journey, and about how the new rules are affecting their work on quality improvement. We'll hear from Monty Marsh-McGlone at the Wisconsin Department of Children and Families, and from Jane Zink at the Idaho Association for the Education of Young Children. So that's our agenda for today. Let's go ahead and jump in. I always like to make sure that everyone knows this is a monthly webinar that's open to anyone who's using the Protective Factors Framework or coordinating Strengthening Families efforts. My organization, the Center for the Study of Social Policy, jointly convenes these with the National Alliance of Children's Trust and Prevention Funds. And we take turns coordinating topics and guest speakers. We always welcome volunteers from the network, which is all of you, to share an interesting topic, something you've done, anything you'd like to share. If it seems like something others in the network might also have a similar question or want to hear about that experience, please contact me, and we'd love to set up a webinar to focus on your topic of interest. The recordings and materials from all these webinars are posted on a Google site maintained by the Alliance. You can use that link. That link will also go out in the follow-up email that goes out after the webinar. So we do this on the second Thursday of every month, and the next two are going to be exciting ones. On February 9th, we'll hear about building protective factors with American Indian and Alaskan Native parents with presenters from Colorado and Alaska. They've been doing some really innovative work in both of those states, and I think there's a lot to be learned about that, both for reaching that particular population of American Indian and Alaskan Native parents, but also just for thinking about cultural adaptation for reaching different groups. And especially with the Alaskan experience, some of how do we reach folks in remote locations to make sure that they're getting the support they need. So you can register for that already now, and the invitation will go out in our Strengthening Families e-update towards the end of this month. Then on March 9th, we'll hear about 3 years now of mini grants that have been going out in West Virginia to support Strengthening Families strategies. And Jeanette Rousey, the Strengthening Families coordinator, will be sharing what they've been doing there, so that should be an exciting one. And just mark the second Thursday of every month at this time, and know that the topics will be announced usually about a month in advance. A couple of webinar tips. If you're having audio trouble, it can often stem from the system not knowing which way you've called in. So if you're using your phone, make sure you check that telephone box and enter your audio PIN so the system connects your phone line to the name you registered under. The other, really high-tech way to solve a problem is always to hang up and dial back in, or to switch to the other mode. If you're on your phone and it's not clear, hang up the phone, switch to mic and speakers, and see if you can hear better. When we get into the Q&A session, and actually throughout the webinar, we always welcome your questions or comments. You can type those in under the questions box. There's two images here to show, depending on which way you've accessed the webinar today. And you can also raise your hand if you'd like to be unmuted and would speak. So if you're in a place without a lot of background noise and you want to speak, please do that, and we can unmute you at the right time. The one other thing I wanted to announce from CSSP this month is that we just released a new toolkit that's very relevant to a lot of your work. It's called Ripples of Transformation, Families Leading Change in Early Childhood Systems. So this is a family engagement toolkit that came out of First 5 Alameda County, which is one of the members of our Early Childhood Learning and Innovation Network for Communities, or EC-Link. We gave some research to action grants to groups of communities through that EC-Link community. And this project on parent engagement resulted in this fascinating and really well done toolkit we're very excited about. It talks about family engagement on a continuum and leadership on a continuum from first teacher to policy advocate, and really gets into thinking about family and parent engagement beyond educational settings, which we know that most of the language and tools we hear about family engagement is focused on how we do that through a classroom. And even in the early childhood years, we hear a lot about it through early care and education settings, but this gets beyond that. So I really encourage you to download the toolkit, the link here. And yesterday there was a webinar about the toolkit with examples from 3 different communities that are part of EC-Link and were part of developing the toolkit, where they talked about ways that they've advanced family leadership. And it was all really fascinating and good stuff. So if you missed that, I'd encourage you to look it up. There's a YouTube link here. It's also posted under webinars on the CSSP website, where you can always find all of the webinars going on through CSSP. Now I'm going to hand off to my colleague at the National Alliance of Children's Trust and Prevention Funds. Meryl Levine is with us today. Meryl, can you take the mic?
Sure. Happy New Year to everyone. I'm happy to be here with you all this afternoon. And I'm just going to give you a few updates. One is the development of our certified trainers through the National Alliance of Children's Trust and Prevention Funds. We continue to grow, and at the current time we are right now with 606 certified trainers, and as you can see from the map, we have trainers all across the country, and that's very, very exciting. We are continuing to grow, and if we go to the next slide, you will see there that we have, we will be adding very soon from Oklahoma more certified trainers. We do have a training scheduled in February 13th to 16th. If there are any people that are interested in attending that training, we do ask that you connect with Martha by email. Martha Reeder's email is right there on the screen. Right away, she'd need to know if you are interested by January 20th, and we will see about being able to add you to that particular training. We also have another one scheduled in April in Sacramento, California, and so want to keep you abreast of that. And if you have any other information, any other questions, or want more information relating to these training opportunities, there is a link right up on the screen right here. But again, if you are interested in attending the February one, please email Martha right away. On the next slide, I wanted to just give you an update. I know that people have been hearing periodically as we do these calls about the Birth Parent National Network. And last year, the network did a series of what we called structured conversations, and parents really led those structured conversations, and they were different topic areas that we covered through those sessions. And we asked parents about their perspectives specifically on prevention and early intervention services, as well as substance abuse issues and how to maintain families, especially when substance abuse might be an issue that they're facing. When we moved forward with the information that we gathered from those structured conversations, we were able to develop a couple of series of issue briefs. And so these are the beginnings. We hope that we will continue to put more out, but I did want to let you know that you can download these. They are available right now for release. And the piece that I think is very, very unique is that both of them work from, based on the input that we got from the parents, the importance of building protective factors in families. And so both of these particular issue briefs actually address that. So we have one that is entitled Keeping Families Together and Strong Through Prevention and Early Intervention Strategies. And as you go through it, you'll see that we do put in their helpful prevention and early intervention resources, and one of the key ones listed was building protective factors. On the substance abuse, the actual title of that one is Using the Protective Factors to Understand Substance Abuse and Recovery. So we hope you'll take a look at those. And the last slide is really, if you are interested or know of parents who might be interested in joining the network, please, here is the information in terms of the web link, and I am the contact person. So with that, I will turn it back over to you, Kaylin. Thank you so much.
Thank you, Meryl. And I do want to make sure people know that if you look in the handout section of the webinar itself, you can actually download those 2 new issue briefs. So you can go to the Birth Parent National Network part of the website, or you can just download them here. And I'm really excited to see those. So thanks, Meryl.
Okay.
Okay. And now we're going to get into our topic for the day. Here's a lovely photo of Rhiannon, who, as I said, is not able to join us due to child health issue and the kind of need that all of us working parents can relate to. So I'm going to be going through the materials that Rhiannon had prepared, and forgive me if I'm reading a bit from her notes, but I think it's all really good information, and then we'll be hearing the 2 state perspectives on how they're seeing these changes and what they're looking ahead to in Wisconsin and Idaho. So let's talk about implications of CCDF for quality child care improvement. The goals for today are to talk a little bit about the importance of high-quality child care and why it's a policy concern. Talk about the Child Care and Development Block Grant, CCDBG Act of 2014 and its final regulations, which we also often call CCDF for Child Care Development Funds. We'll talk about the ways in which state quality rating and improvement systems are supported through CCDBG, and then some ideas of approaches for incorporating strengthening families into state QRIS through CCDBG. So of course we all know that high-quality child care is very important, but from a policy perspective, it's seen as a multi-generational resource, both for enabling parents or guardians to work, go to school, or attend training activities, but also for their young children to be cared for in quality early learning environments, supporting their healthy growth and development. Nationally, we know that 61% of children under age 5 participate in some type of regular child care arrangement, whether that is relative or non-relative care. And we do know that participation in high-quality early childhood and school readiness programs can improve educational outcomes for vulnerable groups of children, including those coming from families with low incomes and from cultural and linguistic minority groups. Many families, however, lack access to affordable high-quality options. So the subsidies provided through CCDBG provide eligible low-income working families with the necessary resources to afford child care. The data that we have from fiscal year 2015, which is still preliminary, not official, show that CCDBG served approximately 1.4 million children, very diverse group. 41% were Black, 23% were Latino, 41% were white. Approximately 55% of the children served are under age 5, 60% lived below the poverty level, and 78% of the families who received that assistance reported employment as their primary reason for needing care. The Child Care and Development Block Grant of 2014 was passed with broad bipartisan support from Congress, recognizing that dual role as an early childhood education support for children and a work support for low-income families. The key provisions of the law support goals intended to improve the health, safety, and quality of child care while making it less burdensome for families to access stable child care assistance. Some of these key provisions are to protect the health and safety of children in child care. That's done through more consistent monitoring standards of child care providers and by requiring providers to complete health and safety trainings and undergo comprehensive background checks. Another key provision is to provide transparent consumer and provider education information through the development of consumer-friendly and easily accessible website, which posts monitoring and inspection reports, processes for licensing and monitoring child care providers, and offers information about best practices for child development. The Act also establishes family-friendly policies, so enabling families to access high-quality child care and support the continuity of child care. And that's primarily accomplished through establishing a 12-month minimum eligibility period and a graduated phase out of the benefit as income rises. So some of the issues that families receiving subsidy have dealt with in the past of having to prove they're eligible every 3 months or less, and of losing the benefit as soon as their income goes above a certain threshold. This act attempts to improve that. And finally, to improve the quality of child care and the early childhood workforce through an increase in the minimum quality set aside over 5 years. I'll say a little bit more about that. In most states, CDBG is the primary funding source for the child care system and infrastructure, as well as initiatives for improving child care quality. So beginning in 2016, over a 5-year period, the law phases in increases to the minimum set aside for quality from 4% to 9%, and it's a 3% minimum going towards improving the quality of care for infants and toddlers. The law requires that states use these set-aside funds to carry out at least one of 10 required activities aimed at improving child care quality and increasing parental options and access to high-quality care. Some of the suggested activities include supports for training and professional development of the child care workforce, providing technical assistance to eligible providers that enhances the development of preschool and school-age children who are receiving subsidy, building the supply of infant and toddler child care, which we know is often in high demand and short supply in many communities, developing, implementing, or enhancing an existing tiered quality rating improvement system supporting provider quality. The CDBG Act requires states to annually report on expenditures, activities, and the measures used to evaluate their quality activities, and then the final rule supplements this provision by requiring states to produce an expenditure report and a quality progress report about those quality investments. Many states also use the CDBG resources to create or enhance their state quality rating and improvement system, as most of those activities are supported by the quality set-aside funds from CDBG. CDBG and state QRIS are natural partners in that they both aim to increase the quality of early care and education services, increase consumer transparency for higher quality child care, and increase professional development opportunities for early care and education providers. States choosing to utilize the quality dollars to strengthen their state QRIS had to express this in their CCDF state plans, where they've identified ways they intend to enhance the QRIS based on the requirements from CCDF regulations. Under the CDBG Act of 2014, states are required to develop triennial plans that identify how they'll spend the federal funds they receive. These 2016 to 2018 CCDF state plans included 26 new requirements from the Office of Child Care that align with the provisions of the reauthorized law. On March 1st, 2016, states had to submit their finalized plans outlining how they plan to increase the quality of child care in their state and enhance access to low-income families with young children using CDBG funds. In total, 49 states and territories included developing, implementing, or enhancing a tiered quality rating system in those state plans. Effective June 1st, 2016, the state plans provide a glimpse into current and planned efforts, initiatives, and implementation plans for each state and territory's child care subsidy system through September 30th, 2018. The issue brief that's pictured here is from CSSP about an equitable and multi-generational approach to those state plans. So I encourage you to look that up on our website as well. I can even provide a link if you I'll add that in the chat box once others are talking. So then we get to the Strengthening Families approach, which aligns with the priorities set forth by CDBG, with the emphasis, of course, on family engagement to increase family strength, enhance child development, and reduce likelihood of child abuse and neglect. With Strengthening Families' flexibility and how it's integrated on multiple levels into existing early childhood programs, strategies, and systems, many states have found it useful as they think about how to improve child care quality. So 17 states are incorporating the Strengthening Families framework into their state QRIS, and we put out a brief a couple of years ago about what that looked like in states. And I think Anna Lovejoy is going to speak a little bit about that. I'll mention one more thing here before Anna jumps in, that the Strengthening Families self-assessments, when we redid those in 2014, they were part of the redesign was to make them feed well into a quality rating and improvement system. So the self-assessments for early care and education, both the center-based and the family child care, are tiered, meaning that there are items that are at a baseline level, a mid-level, a high level, and then for the center-based, there are items that are for comprehensive service programs. And it's a way for programs to look at which items they should be doing as a baseline, what they could be adding as they get more invested in this work and more committed to family engagement. It's also a way that a quality rating and improvement system could use to align with quality standards and say if you're going to be a 2-star program, you need to be hitting the mid-level items on the Strengthening Family self-assessment. So Anna, do you want to say more about how states are using Strengthening Families in their QRIS?
I would love to. Hi, everyone. So I'll just preface my remarks with, I guess, a caveat that the work that we did back in 2015 is a couple of years old, as Caitlin said. So things may have changed a bit in states, and you know, we haven't really been able to, since then, go back and do a comprehensive look at, you know, what has changed. But basically, if we want to at least start with this snapshot from actually the end of 2014 and early 2015, there were a few themes that we were finding across the states that had integrated Strengthening Families into their QRIS. And a couple of the reasons or the advantages that they had identified as using, you know, why they would want to use Strengthening Families to inform the design and implementation of their quality standards related to parent, family, and community engagement relate to, well, a couple of things. One, Strengthening Families informs a comprehensive and concrete definition of family engagement because it helps early childhood programs identify concrete and specific ways to engage both parents and caregivers. I know I'm kind of preaching to the choir here, but it also provides tools that are already available and free for states to use to help support implementation. Strengthening Families offers a flexible roadmap for programs to achieve their family engagement outcomes. The approach offers a high degree of flexibility, but is also grounded in research about what we know about the protective factors and how important they are for families. And the third, actually four, the third of 4 points I wanted to make is that Strengthening Families aligns with nationally recognized indicators of quality and family engagement, for example, NAEYC's accreditation standards, and at least the previous version of the Head Start Parent, Family, and Community Engagement framework and the program performance standards. We haven't yet been able to do a scan and crosswalk with the new Head Start performance standards, but we would love to be able to do that in the near future. And of course, Strengthening Families also provides a platform for linking QRIS to broader systems building efforts. So in other words, if Strengthening Families is being implemented broadly across multiple sectors in a state, including early childhood family support, child abuse and neglect prevention, child welfare, could be children's health or mental health, it provides a unique opportunity for QRIS efforts to be developed in the context of that broader shared language around family support and engagement. So we found when we were looking across the states that there were a couple of different ways that states were integrating Strengthening Families. One was into training and use of the self-assessment tools. So at the time, Missouri was piloting, New York and New Hampshire and Arkansas were integrating some of the Strengthening Families self-assessment items into their QRIS criteria. They were encouraging or requiring programs to use the freely available self-assessment tools. or they were including strengthening families trainings as part of the optional or required professional development criteria. Some states have used it to, or have integrated strengthening families into their online QRIS systems, where they actually link to the online strengthening family self-assessment so that they can aggregate data from programs and providers up to the community and state level. There are other states like Georgia, Washington State, Idaho, and Massachusetts that have really integrated strengthening families rather deeply into the types of trainings and criteria, and using the self-assessment tools, and really kind of covering all of the bases that I've just touched on in a meaningful way to support families. So that's just kind of the recap of what we found. Again, I think we had identified for sure 17 states at that time. And since then, I think other states have been also moving forward, either specifically with strengthening families, or also using in some combination the national or the Head Start Parent, Family, and Community Engagement Framework, which brings me to the last point that I wanted to make, and that is that CSSP is one of the consortium partner organizations on the National Center for Parent, Family, and Community Engagement. And the center is jointly funded by the Office of Head Start and the Office of Child Care. And we are working with our colleagues at Brazelton Touchpoint Center, Child Care Aware of America, and take what was originally developed, that Parent, Family, and Community Engagement Framework that was originally developed specifically for Head Start programs, and make it relevant, applicable, and meaningful for state child care and early care and education systems. So we are working on that. It's really exciting work. We're thrilled to be a part of it. I think that it's definitely the tools and resources that we're developing, we hope will also complement rather than compete with things that states are already using and have integrated into their systems using the Strengthening Families tools. So we look forward to the coming year when we'll start rolling out some of the things, and look forward to conversations with folks at the state level about, how they're approaching using any of the new resources coming out, or how they're continuing to integrate strengthening families into their QRIS. So I'm going to stop there. Thanks, Kim.
Thank you so much, Anna. It's nice to hear you back on one of these webinars. I think it has been a while, and that was really helpful information. So let's continue on. Some other opportunities to advance strengthening families through CCDBG. Of course, the Act and the final rule both require states to provide parents and caregivers with information, enabling them to make informed consumer choices and access information to support child development. And this includes providing parents or caregivers, child care providers, and the general public with information regarding research and best practices concerning children's development, including meaningful parent and family engagement and physical health and development. As Anna mentioned, the Strengthening Families Framework provides some of the tools that can help to design and implement quality standards related to parent, family, and community engagement. I won't go into that more because Anna just covered it really well. And another piece is that the CCDBG Act of 2014 requires states to make information available to parents, providers, and the general public through electronic means. Some of the Strengthening Families materials may be useful for that purpose. As I mentioned before, there's some language in those final rules about consumer-friendly websites ensuring the widest possible access to services for families, including those who speak languages other than English and persons with disabilities. And I think there are opportunities to use some Strengthening Families language in that communication. Another thing that can be useful when integrating Strengthening Families with the QRIS is the Strengthening Families Evaluation Portal. It includes the self-assessment and other related tools that enable state-level administrators to view aggregated data, to identify trends and inform decisions about training, technical assistance, and other forms of program support. The evaluation portal includes the online version of the Strengthening Family Self-Assessment and a tool to turn that self-assessment result into an action plan. And that includes the assessments that I mentioned, the tiered ones for early care and education centers and family child care, but also the home visiting program self-assessment and community-based program self-assessment, which are not tiered. It also includes an online version of the Protective Factor Survey tool to measure changes in parental protective factors, an online staff survey tool, and pre-designed reports that make data more easily accessible to programs and states. I should mention, for those of you who haven't looked at the evaluation portal recently, it's a much improved tool from the earlier Strengthening Families online tool provided by our partners at Mosaic Network. And I'd encourage you to check it out. It is free for programs to use. There are administrative plans available if you want to get the oversight over multiple programs within your state or community. And it really does have a lot of potential for building into QRIS, and not even in QRIS, but in other uses as well. But it can certainly be used to deepen Strengthening Families implementation in programs and help them keep track of their work and evaluate its impact on both parents and staff. So moving forward, while states are well on their way to implementing the new requirements of the CDBG Act of 2014 and its final regulations, state lead agencies should begin thinking ahead to the next triennial cycle of CCDF state plans. In an effort to continue improving quality standards for the most vulnerable groups of young learners, be sure to advocate for the utilization of existing resources, such as Strengthening Families, to improve outcomes for these children in CCDF state plans. Some of the questions you might want to ask yourself and your colleagues and associates and other systems serving young children and families would be, do you have a seat at the table to speak to the validity and encourage the use of Strengthening Families in state QRIS and early childhood systems? Are you aware of state timelines for soliciting input and submitting finalized CCDF state plans? Are you in talks with other states who have successfully incorporated Strengthening Families into their QRIS? And what knowledge or lessons do you have to share with others embarking on this journey? Rhiannon compiled this slide full of resources that you might want to use in your efforts. And as usual, these slides will be available on the Alliance website after the call. So I encourage you, if you're able to take a screenshot of this right now, go ahead and do that. Otherwise, get those slides afterwards and you can follow these links. So now we're going to hear from our state speakers about specific strengths, opportunities, and challenges they've encountered in their work. And I'm going to just check in quickly that we have received a couple of questions, which I think will be something that's probably going to be part of what you're answering. So Monty and Jane, I think you already probably have this question in mind, but I'll read it out now. This is from Jim McKay in West Virginia, asking, does anyone on the call have suggestions for how their states are paying for these new requirements with very limited new appropriations from Congress? So that's an important and perennial question. I also see a couple of questions from Hope Darden Swift about the pre and post test and about Strengthening Families evaluation portal. I'm going to answer those questions. I'll type in some answers for you, Hope, while the other presenters are talking. And everyone else, feel free to type in questions as we go, and we'll try to get to all the questions that come up. All right, so we're going to dive into the view from Wisconsin to start. Monty Marsh-McGlone is on the call from the Department of Children and Families here in Wisconsin, where I also happen to live. So he's the Race to the Top Professional Development Supervisor, and he's going to talk about Young Star and Wisconsin's quality improvement efforts.
Hello, everyone. Good afternoon. So, again, my name is Monty. I'm here at the Wisconsin Department of Children and Families. I'm going to jump into Young Star to begin with, and sort of what we're doing around CCDBG and CCDF. So the first thing I want to highlight is our website, Young Star Child Care Search, where it provides the contact information for programs. If they're participating in Young Star, it has their rating. It also highlights the regulation details, enforcement actions, stipulations, warning letters in the last 2 years. So getting that information out there to parents is important. So it also shows capacity, it shows hours of programs for those parents who might be looking for something in the afternoon or evening care. It also goes into our rating system. So programs that are eligible to earn points, it will highlight what points they've earned out of what points possible, and then also give parents a link to go into those rating details and get a little more in depth of what providers have been learning. So we've really put it all out there for parents to make the best and most informed choices in terms of care for their children. And on the website, there are also contact information for parents who would like it in Spanish or in Hmong as well. So within Youngstar, we've had a couple of changes as of 2017. First off is that we're going to an every other year rating, and that, you know, doing a rating every year, we heard feedback from providers that it was a lot of work, and going to an every other year rating kind of helps us delve deeper with those providers who are really looking for more work, for more improvement. Within Youngstar, we have our family engagement criteria. Now, it's pretty extensive. There's 5 different categories which reflects the protective factors. Our categories are transition, family involvement engagement, family communication strategies, family support strategies, and family community connection strategies. So programs as of 2017, programs are required, that are 3, 4, 5 stars, are required to earn 1 point for 3 stars and 2 points within our criteria for a 4 or 5 star rating. Now, within these 5 categories, there are 2 tiers, Tier A and Tier B. So there's a whole lot of options. So we're not really being prescriptive in terms of family engagement. There's a lot of variety, a lot of choices that many programs are already doing and can be successful in this family engagement criteria. So we do support the Strengthening Families training through Youngstar. You can earn additional points, and it is provided throughout the state in all of the regions to ensure that programs can access this training wherever they are in the state, whether it's urban, whether they're rural providers, family or group, or school-age programs as well. So we can go to the next one now. Thank you. So let's talk a little bit about health and safety and family-friendly policies here. So we support the Wisconsin Model Early Learning Standards, which is also part of our family engagement criteria, in that helping families understand those early learning standards and this framework of child development and expectations for different ages, and helping parents understand just child development in general. So we provide that training throughout the state. It's more of our intensive trainings, but it's important when we're having those conversations with families and providers, and that we're all on the same page about these learning standards. Within Youngstar, we have the professional development and education training requirements. So for us, that is what we're finding is the barrier between our earning the higher star ratings compared to 2-star programs. So we are doing everything we can through Race to the Top and through Youngstar to support that education. Throughout Race to the Top, we have our Educational Opportunities Grant. So providers in 2- and 3-star programs are eligible for no-cost credit-based credentials to help them earn those higher star ratings. And that we've actually been able to sustain through our Teach Scholarship program throughout the state. So that will be continuing past Race to the Top. We focus on social emotional health. So we support Pyramid Model. We also support parent cafes, so engaging families in their communities, typically supported by the Child Care Resource and Referrals. So there are other agencies that support parent cafes throughout the state. And getting them more information about Youngstar, getting them more information about access to high-quality care and the importance of high-quality care. We are focusing on inclusion to help some of these special populations. We've been supporting a website, or some additional pages to our website, excuse me, for both parents and providers to help that conversation of getting children with special needs and disabilities included into our programs. And finally, we have been working to support families experiencing homelessness, as we are hearing that providers would like more resources. So we are working in conjunction with the Department of Public Instruction to gather those supports, curate that information, and hopefully host it on our website by the end of the year. So that's just a little quick, brief overview of some of the things that we're doing in the state. If you have any questions, I'd be more than happy to answer them at the end, or you can feel free to email me anytime with any questions that you have.
Thanks so much, Monty. I think we'll go ahead to Jane now, and then we'll see if folks have questions at the end that maybe we can all chime in to answer or see who they're directed to. Okay, so that was from Wisconsin. Now we've got the view from Idaho, and Jane Zink is with us, a frequent contributor on these webinars. Thank you, Jane, from the Idaho AEYC.
Okay,
ready to go, Jane?
Yes, thank you.
All right.
I just thought maybe I would answer the question, at least from Idaho, about how we're paying for the new requirements for health and safety trainings. And I just wanted to chime in that actually we have 12 hours of training, which I'll talk about shortly, and they're all distance trainings, and they're all free of charge to providers. We've just tapped into AAP, to FEMA, and then we have lending libraries throughout the regions, and also we have our own YouTube video channel that we have trainings on, and the providers are accessing those trainings. So we took training that we developed and we made it accessible so providers could use it.
Great, thank you.
Yeah, sure. You can go to the next slide. So we have in Idaho, it is winter in Idaho. We're on our 6th snow day, and everybody on the call should feel sorry for all those stay-at-home parents with their kids who can't go to child care. We have had lots of challenges with this, with the requirements, because the requirements really represent a significant jump. So in Idaho, we don't have a uniform child care licensing throughout the state. We have some cities that have licensing. I think there are 9 municipalities that have a child care licensing. But across the state, we have a general state licensing, and that professional development requirement was 8 hours every 2 years. However, to be eligible to receive the Idaho Child Care Program or the subsidy dollars, there was 0 professional development required. So if you didn't have to be state licensed, or if you weren't state licensed, then you could still accept ICCP with 0 professional development. So we were kind of at the bottom for that requirement prior to September. And so now with the 12 hours of year, it really represents a significant development and a stretch for our child care providers. In deciding which trainings to choose for kind of this package of trainings that were going to be required for programs, we capped out at 20 hours a year, or 20 hours, 12 hours per year. And strengthening families is not included in that 12 hours. We have a 20-hour training series called Essential Trainings that coordinate with our quality rating and improvement system, and strengthening families is part of that. But we didn't feel like we would be able to convince providers to take the whole 15 hours, so we capped it at 12, and we left strengthening families out of that. Another challenge that we've had is we really overestimated our providers' technology literacy and the rural access. We have more people on dial-up than you can even imagine still in Idaho. And we had a lot of trouble with people who just being able to access the technology, being able to use the computer, being able to access a computer, being able to navigate through a website, those sorts of things. And so as a result, our capacity has really been strained. We do have 25 TA providers, and they've really shifted their focus to the CDBG trainings, away from QRIS and therefore strengthening families. Strengthening families is embedded in our QRIS, and so we can't really talk about one without the other. And so any effects on our QRIS are also effects on our strengthening families work. We've had a lot of training challenges, again, with online training, with access literacy, the multiple websites, and then evaluating completion and competency. And our staff has just been really strained to the max with that. We've also had a number of sites in QRIS fall. The enrollment dropped, and we've seen programs backsliding, not able to maintain their level of quality from year to year, not being able to meet the deadlines. And so we're kind of in this place of disequilibrium in Idaho, and we're struggling a little bit, but we definitely can see how this is going to position us better for the future. And so on the next slide, you could turn the slide, Kaylin. Look at all those ducklings representing the future spring. We're really looking ahead. We know that when the providers in our state have completed this 12 hours of training in the first 90 days of employment, that they are going to be better positioned to complete the Essential Training 1. We also have seen a significant increase in the professional development registry system applications, because we're trying to counsel people, as long as they've taken the first 12 hours free for their child care ICCP eligibility requirement, it's not that much farther to get the rest of the trainings, which they can access using a scholarship to the professional development registry. And in that 20-hour package, Strengthening Families is included. All Essential Training includes the Strengthening Families, so we feel like as providers get introduced to professional development and encouraged to join the PDS and understand the financial incentives involved with that, that we will begin to reach providers that we might not otherwise have reached. We do have in-person Strengthening Families trainings. Taking the Alliance trainings is one option, but we also have in-person trainings in each region of the state on a regular basis, and this really invites providers into relationship with both trainers and the CCRCs. So we are reaching providers, again, that might not have had any contact with trainers or the CCRC, and we're hoping that with the Strengthening Families being offered in face-to-face, and our trainers, skilled in delivering the protective factors as they deliver the training, that this is going to invite providers into a relationship. And then the other great thing that's happening is directors of centers are learning to track professional development. Again, that wasn't on their radar in the past. They didn't have to do anything like that if they weren't licensed by one of the cities. And so learning to track professional development is really useful for steps to quality, and that skill is really going to increase retention in steps to quality and provide more exposure to training and technical assistance on the framework. So although we're having a little disequilibrium right now, we really feel like we're well positioned when we move through this phase to really reach more providers than ever, and we're very excited about it. The other piece that we are working on related to the grant requirements are to think about how to best serve families who are experiencing homelessness. So we have a work plan around that, and including new training for child care programs that helps participants identify concrete strategies for promoting the protective factors in families experiencing homelessness. So this is a 2-hour training that's delivered through the lens of the protective factors. And there are 3 objectives, and that's to help participants learn the definition, effects, and rates of homelessness in Idaho and nationally, to identify signs and symptoms of trauma in children and talk about how to respond appropriately, and then to identify how we can intentionally use the protective factors to reduce stress in families. So those are the kind of the main focus in Idaho at this point.
Thank you, Jane. We have had some questions come in, so I'm going to read those. Let's see. Jim has a follow-up question, more detailed. Let me get to it. Sometimes, there we go. Sometimes hard to read these things. So Jim typed in a second question, saying the 12-month eligibility is the higher cost for West Virginia with the new CDBG requirements. That's our biggest challenge to implementation. How is Idaho or others paying for that adjustment?
That I don't know the answer to, but I could certainly find out because our state administrator isn't here, and I think she might be the person to ask about that.
Okay, and Monty, do you know how the 12-month eligibility is affecting Wisconsin's budgetary approach?
I am not sure of that as well, but I'm happy to look into that information and send it out.
Okay, and if there's anybody else on the call who does know how your state is doing that, I'm going to write in an answer here so that everyone can see this. the questions don't show up for everyone unless I type an answer that's visible to everyone. So now you can see the question. If you know what your state is doing to help cover the costs of implementing 12-month eligibility, please chime in with that. We also had someone had their hand raised, so let me just check on whether that person wanted to speak. Erica, I'm going to unmute you and see if you have your hand raised to ask a question. Erica Gibson, are you there?
Yes. You can dial in. Uh-oh.
Hello?
I did not.
Okay, I think that may have been an accidental hand raise. Erica, if you did want to ask a question, please type something in the chat box and we'll get you back in. We had a couple of questions come in about the Strengthening Families Evaluation Portal specifically. Since we mentioned it, I'll go back to that slide and just share a little bit more information that it is, sorry, too many things going on here. Let's find that slide. For those of you who haven't been on it, just to be clear, there's this green button here that's on the main page. Click here to register for free. So as a program, you can register for free. You can fill out self-assessments. If you're actually a organization that includes both child care and home visiting, for example, you can fill out both of those self-assessments within the system. You don't have to just choose one. Another addition to that's different from the original system is that you can now go in again and update your self-assessment after some time. We had people having to create new accounts to do a separate self-assessment earlier. So this way you can update it over time to show the progress you've made. It does help you, it'll highlight all the areas where you rated yourself lower and ask if you want to include them in your action plan, and then you can set an action plan with who's responsible and what the tasks are, what the timeline is, what the budget is if needed. So it really guides you through a process as a program of figuring out the next steps you'd want to take. And then at the administrator level, if you're in a state position or even a county or regional position and you would like to have oversight to see the data that multiple programs are entering, then you can get an administrative account. And there is a cost for that. You'd have to work with Mosaic to determine how many programs you need oversight over and whether there's any custom reports you need and things like that to determine the cost. But that is available to give you the aggregated data and allow you to analyze that. There were a couple questions coming in just about username and some more detailed questions about setting up the account. Please use the contact information that's on the evaluation portal itself. That goes to a help desk at Mosaic with people who know the system in and out and can definitely help you through it. I am more at a user level and I'm happy to try to help, but those folks at Mosaic are very well familiar with it and happy to help. So those were the questions that had come in about the Strengthening Families Evaluation Portal, which is just one piece of this bigger content. Are there any other questions that folks wanted to ask of our presenters today? Or anyone else want to share your state experience of implementing these new guidelines? Okay, well, we may actually wrap up early today unless someone has another question. I see some questions coming in about the link to the Strengthening Families Evaluation Portal. I just did this yesterday. I typed strengtheningfamiliesevaluation.com and it came up. If that's not working, try strengtheningfamiliesevaluationportal.com or just Google Strengthening Families Evaluation Portal and it should come up. If you're having trouble with that, email me and I'll help you sort it out. I'm not sure why that, sometimes it's maybe whether you say www or not, so try playing around with that too. But it is under, actually when I checked yesterday, you could get to it through either of those, strengtheningfamiliesevaluation.com or strengtheningfamiliesevaluationportal.com. Okay, well, I think those are all the questions we have. I want to thank our presenters very much. Monty and Jane, it was great to hear your perspective and really welcome everyone. I think Anna wants to share one more resource, and please jump in, Anna, to do that.
Okay, yeah, thanks, Kaylin. It's actually not available yet. It's just a heads up that forthcoming in the next couple of months at the National Center on Parent, Family, and Community Engagement, we are actually developing an online set of training modules related to the new homelessness provisions for child care and for Head Start. And so those will be available in a couple of months, and they really will be tailored to Head Start and child care settings, and we're also in the process of developing some content that is more specific to the role of state administrators in terms of you know, what the new regs mean for them, and how to think about applying them through different ways in the system. So stay tuned. I just wanted to, you know, we know clearly that a lot of states are working on this and have a lot of questions, and we will be hopefully meeting that need soon.
Great, Anna. Thanks for mentioning that. We will definitely share on this webinar when those modules are ready. I'm also, because of the number of questions we've gotten about the Strengthening Families Evaluation Portal, this is reminding me that perhaps we should do another webinar soon focused on that and how people can use it. Certainly, you can reach out to Mosaic anytime for support on it, and they are more than happy to help. The help desk is there supporting that tool and other tools that they offer. So feel free to call their help desk and get the help you need, but we will also I'll have someone from Mosaic come onto one of these webinars soon, which we haven't done in a little while, and share information. So thanks everyone for participating. Thanks again to Monty and Jane for sharing your state perspective, and thanks to Rhiannon, she's not here, for preparing the first part of that presentation, and thanks to Anna for stepping in to help with that as well. Wonderful afternoon to everyone, and we will talk again soon. Thanks a lot.